Yeah. So my presentation today will be about instilling social accountability into health professional education curriculum. And I'd like to share with you the one of the recent publications that we have published during the current academic year. And this publication has been published in Medical Teacher Journal. It is one of the top journal in medical education in terms of ranking and in terms of the feasibility. And this publication is done along with our colleagues from different universities in Ireland, in Canada, in South Africa, and also in Gulf Medical University here. So this AMEE Guide is one of this publication under the theme of the AMEE Guide, and AMEE Guide is considered one of the best evidence practices in health professional educations, aiming at guiding the medical educators with best practices in the field of teaching and learning, assessment, and the community service. So I will provide a brief overview of the topics. Then I will go directly to the outline of this AMEE Guide, and which aim at instilling social accountability in education. And as you know, social accountability for health professional education need to be instilled not only in education domain, it need to be instilled in education, in the research domain, and the community service domain, as these the three important domains for any educational institutes, whether university, colleges, or center. And let us start by defining the social accountability. As you know, social accountability has been defined by the World Health Organization in 1995 as obligation, and obligation here related to social obligation or social contract between the educational institutes and the community that it serves, either at national, regional, or even global level. So it is the obligation of medical or health science schools to direct their education, research, and community service activities toward addressing the priority health concern of the community, region, and nation that they have the mandate to serve. And the question here, who should determine the priority health concern? Is it the community? Is it the Minister of Health? Or who should determine this? So this should be determined by the government, healthcare organizations, health profession, and the public. And in order to determine the priority health concern of the community, region, or nation, this pentagram has been proposed early in 2000s, and this is related to the stakeholder of any educational institute. And as you can see here in the screen, the educational institute is one of the pillars that should collaborate with each other to support the health system based on the health of the health or the people needs. And as you can see here, each academic institute, each university, they should have a partnership together with the community, with the health administrators, with the policymakers, with the health professions, including the graduates, to determine the population health needs. And they should work together to address these needs. So go back to the definition. So it is related to redirection of all the efforts that exerted by the medical or health science school to serve the community. And this is the main mandate of medical education. Medical education, the main mandate is to improve the population health rather than focusing on the educational process itself. And based on that, the colleagues has been classified as either social responsible or social responsiveness or socially accountable. And social accountable is the higher level of any educational institute. So social responsibility, it is related to state of awareness of the duties of the students, awareness of faculty members to address the needs. And this is the lowest level. Social responsiveness, it is related to there is awareness plus some course of action in addressing these society health needs. While social accountable health professional education, it is related to have explicitly measurable activities to provide evidence that this program is proactively, not reactive, not neutral, is proactively meet the societal needs. So social accountability is related to the proactivity to the community needs. And as you can see here, this is part of the social obligation skills. The social accountability is the highest level, and the social accountability, the program learning outcomes is defined by the society, not developed by the faculty members, not developed by the university level. The educational program is not community oriented or community based. It's above that. It is contextualized. That means contextualized to the context. Moreover, it includes some community based and community oriented activities. The graduate of the quality of the graduates, they are definitely good, and they explicit professionalism. This is not enough. They are health system change agent. So for this reason, those graduates need to be educated in a way that support the health system and to act as health system agents. And the focus of the colleague of the evaluation for these colleagues or the programs is not like the old way of approach of evaluation, focusing on the process or the outcomes. No, the focus here on the impact. To what extent our educational programs, they have an impact on the community that they serve. And this impact could be like mid-term or short or long-term impact in the community, such as improving the population health, decreasing maternity, in enhancing the population well-being, and so on. And the assessors for our programs, not only external assessor or international assessor, the assessor to our programs should be the partners and such as you can see here, the policymakers, administrators, community, and so on. So we have the partners who assess the program. So if we have this, then we can say that our program now in the way of being social accountable. And social accountability, it is very close to the concept of the competency-based education, in which the competency is informed by the health system needs or the population needs, and accordingly the program is designed based on these competencies, and the assessment is developed also to assess these competencies. And nowadays, the evolving role of healthcare professionals and doctors has changed in comparison to old way. It's not only now to treating the patient. It's not only to provide clinical services to the patient. It's also to consider the advocacy, health promotion, preventions, and consider the wide concept of the health is not only the absence of the disease. And the competency of our graduates should not be determined only by those who are closely related to the education system. The competency of the graduate should be determined by the patient, and the patient, they should have the right to determine, are we graduating competent physicians, competent health providers, and so on. And as you can see here how the patient see the competent doctors within the realm of the social accountability. So it's not only within the narrow space of treating the patient. So the patient identified competent physician in the domain of social accountability by those who taking into consideration the patient characteristic into account and tailoring the care to individual patient by taking broader community to the account, not only the patient, by balancing between care and individual patient, of individual patient versus the concern of the society, by providing guidance and health education to the patient in a good way, and by taking the entire climate impact into consideration. So it's not only about treating competent physician or healthcare provider for the clinical skills and so on. No, the scope is broad in order to graduate health system change agent. And now, as you will read inshallah in this AMEE guide, uh, the literature found that if we integrate social accountability, and actually the correct term is not integrate, to instill or to embed linguistically social accountability into health professional education curricula, the patient will receive patient-centered care with personalized treatment, considering the socioeconomic and the cultural factors related to the patients. And also will have a reduced health disparity in terms of will have a graduates with the competency addressing the social determinants, lead to fairer health outcomes, and we'll have a better health outcomes tailored to, we have a tailored care, improve adherence and recovery, and we will have stronger doctor-patient relationship or healthcare provider relationship in terms of trust, respect, enhancing communication and engagement, taking into consideration the cultural competencies. And at the end, we'll have healthier communities through our providers, those who will contribute to public health and resilience of the health system. This is related to the benefit for the patient. Related to students' benefits, by instilling social accountability, this will encourage the students to consider the medical and non-medical determinant of health. And according to the WHO, more than 35% of the health problems are not closely related to like infections or certain disease. It is related to the determinant of the health of the social determinant of the health, which may be related to the patient income, to occupation, and so on. Instilling social accountability also is very important for the students to enhance their cultural competence. And by instilling social accountability, it will support the students to enhance respect for diversity, equity, and inclusion, even within the community. Also, instilling social accountability, it will be good practical experience for the students through the community programs and providing hands-on learning on real-world insights, such as being trained in the community settings at the community-based medical education, not only here primarily for the primary healthcare, even including the clinical training in the hospitals within the context of social accountability. It supports the students to build stronger community engagement and build very good listening skills, respecting the community, collaborating with the community, and finally strengthening the purpose and fulfillment of their career, so that they can acknowledge their values and they can choose the right specialty and develop their professional identity, and finally develop their professional satisfaction. So this is for the students and at the students level. What about for the medical schools and health science schools? It will build trust between the medical and health science schools and the public and the partners. And also this will be considered that this health professional education institutes performing its task in alignment with the accreditation standards. Since 2015, social accountability become one of the main principles to be considered in the accreditation standards as defined by the World Federation of Medical Education. And also it will provide a very good graduate impact on the community by producing professionals more likely to serve the underserved area of the community. And definitely it will have an impact on the health system by influencing the health system through encouraging broader adoption of the social accountability principles. So now let's see what are the practical steps that we propose to integrate or to instill social accountability into medical curriculum. We propose to follow the same approach of Kern six-step approach of curriculum development, starting by identifying the problems of the community and doing the general need assessment here. Then assessing the target need assessment, which is related to the graduates, competencies, and so on. Then redesign the program goals, outcomes, and competencies based on this assessment. Then choose the right educational strategies for instilling social accountability, and the AMEE guide talk about that. And then we'll go for the implementation, which the implementation methods or implementation approach that support the educational institute to instill social accountability, such as utilizing authentic learning approach, community-based learning, student-centered, and service learning, and we'll discuss them. And finally, establish a strong partnership with the stakeholders so that the evaluation here will be by the partners rather than process or only outcome evaluation. So from here and the rest of the presentation will follow this stepwise approach or six-step approach. And actually, the AMEE guide also is built around this step of the curriculum. So, and again, it's built by this, defined by the stakeholder. The first step is to identify a key stakeholders of our programs. And we need to consult important stakeholders impacted by the curriculum, ensuring inclusive representations. And here we have to use the pentagram that we have presented here. It's very important to define and the purpose and scope. And here at this level, we need to clearly state the goal of the need assessment, specifying the stakeholders and the audience of the curriculum. And the goal must be explicitly mention social accountability in our programs. And then we need to form a need assessment team who will work on that, then collect the data from the stakeholders, analyzing the data, and then setting priority and develop recommendation based on this data. And then very important to consider validation of the findings. And we do validation of the finding by consult expert from stakeholders to confirm these conclusions. And finally, we need to create a curriculum plan. So we will do this by considering these issues that is related to the integrations, considering the engagement, the cultural competencies, the interdisciplinary collaborations, the ethical issues, and integration into practice. And we have studied in 2022 the impact of community-based medical education on graduate performance using qualitative studies. And it has been found that those students who graduated from schools adopting social accountability principles and values, they have more professional attitude, they have more leadership skills, more communication skills. They also have the belonging to the community that their medical schools and colleagues serve. And also we have developed also this AMEE guides, which is related to integrating social determinant of health in curriculum, and we propose these topics to be integrated in this vertical way and this example of horizontal way, as the social determinant of health is one of the important ingredients to build the competencies that is related to social accountability of the graduates. So now we will discuss moving forward to the educational strategies that can help the educational program to instill social accountability. One of these important education strategies is adoption of the curriculum integration and having integrated curriculum in which we can embed the social accountability's values, the four values, which is related to the relevance, quality, cost effectiveness, and equity into learning as well as the assessment methods. And also problem-based learning has proven to be one of the best teaching and learning methods in which we can inculcate or instill social accountability principles and values. Community-based learning or education, definitely, in which we attach students to community settings for a hands-on learning experience like in the health centers, household, fields, village, and so on. Analyzing studies about what makes medical school social accountable and analyzing the medical and health science schools who receive AMEE Aspire Award for social accountability, almost all of them was found that they are adopting community-based education. And also service learning, in which students will provide service while they are learning. And we have a very good model here in our campus, including the dental colleagues, in which students they are providing service while they are learning. And also many other programs they have these models. Another very good teaching and learning approach that has been found almost in many schools that has been categorized as social accountable medical and health science schools, the adoption of longitudinal integrated clerkship. They don't have the clerkship or clinical rotations as we have here in most of the medical curricula. They don't have like this surgical clerkship or this medicine clerkship or obstetric clerkship or pediatric. No, they have a longitudinal clerkship in which students will learn about different clerkships in integrated way and as a longitudinal across the years. Regarding the problem-based learning, we have developed inventory with colleagues here in Sharjah in 2020-21, and we have conducted a study evaluating the integration of social accountability values into medical education in our colleagues here in Sharjah. And we have also conducted a similar study in Egypt, in Suez Canal. And also we have conducted the same study also in Ireland. So, and it has proven that social problem-based learning could be considered as a good platform or good teaching and learning approach that can instill social accountability principles and values through case-based scenarios. Because in problem-based learning, the student almost spend 1 week discussing the case scenario. And also surface learning proven to be a very good educational approach to instill social accountability into curriculum. And as you can see here, we need to have a stepwise approach in integrating social surface learning in our curriculum, from designing and preparation, taking action, reflecting and communicating and investigating. And this will not take place without establishing good partnership with the community, determine the success criteria of the program, develop a plan of action, then organizing the resources that we have in the colleagues, collaborate efficiently with the other, demonstrate intercultural understanding of action, then preserve through the action and demonstrate commitment. We need also to reflect and communicating the practice. We need to evaluate the impact and then evaluate of the impact of the service, suggest realistic improvement, and then present our learning to a wider audience. Then we also need to investigate by identifying and justifying the need of the service, evaluate the existing actions, and so on. So it is the cycle, it is integrated, starting from the designing, taking action, reflecting, investigating, improvement, and so on. And very most important, there is also misunderstanding to linking social accountability with the community medicine, or linking social accountability with the community-based education or community service. Social accountability is not a responsibility of those who are working in public health or the community medicine. It's our all responsibility because, again, it is a social contract. And the issue here, uh, those authors highlight, if social accountability teaching and learning is focused and explicit only in the primary community care curriculum, then the learner will perceive social accountability to be relevant and valued mainly by community-based specialty. So hospital based education and practice need to consider also social accountability. For this reason, instilling social accountability is not only about instilling social accountability within the public and health and community medicine courses. No, it should be instilled throughout the curriculum, not only within these courses. We should not forget the assessment because assessment drive learning, and assessment at different levels, assessment of the competencies at progress level of the curriculum or at higher level, also assessing the institutional compliance with the social accountability. Assessment should be, they should be multiple assessor, and programmatic assessment here would be the best option for assessing the social accountability. We should have holistic assessment approach rather than only relying on the written assessment or the clinical assessment. And we need to consider full integration of these values across the curriculum. These chapters is written in one of the book that we edited in the last 2 years, provide some suggestions for assessing social accountability in medical education using the written assessment format. It is very important to consider, again, the need assessment, the ethical awareness, the advocacy and training, to consider also the interprofessional education, and to consider faculty development, because without faculty development, we cannot deliver or we cannot ensure that we instill social accountability into medical education, and faculty development is very important. This paper is about how to instill or how to develop a program to train people in the social accountability principles and values, and it is highly recommended paper to be considered. Are we going to face a challenge in existing curriculum? Yes, definitely, because any change will be made by some challenge. We may face some challenge by a colleague. We may face some challenge by limited experience in social accountability. Maybe some challenge about related to community-based education resources, balancing between what we have and what we need to instill. And we need also, we may face challenge related to the leadership support from the institutes. But we do believe that positive change management models, such as using the appreciative inquiry models, would be the suitable change management models that we can adopt to instill social accountability as a change management in our programs, starting by defining what are we doing, and we should affirm that we have very good existing practice that is related to the social accountability in our programs. And then we need to explore and discover, and very important to create, to imagine the future. How will the future look like if we redirect our education, research, and community service towards serving our community? We need to imagine to what extent the health system will be improved and the population health will be improved if we adopt these principles and values in our curriculum. Then we need to, after that, to design and to innovate the way to create the ideal futures. And then we need to work toward reaching the destiny, living out your design and make the king as needed. And then it is actually a cyclical approach that we need to move forward. As part of our efforts in Medical Education Center and as part of our efforts in the Social Accountability Committee in the Medical Education Center, Alhamdulillah, we managed to develop this guide for faculty, and we have distributed this guide last week about how we can instill social accountability. This guide is not only at educational level, but also at service and and uh, research level. The conclusion and call to action from this publication forum and from this AMEE guide: social accountability is essential for training healthcare professionals in order to meet the societal need. Our medical and health science program must commit to integrate social accountability in all aspects of education because it is social obligation that we need to serve our community. Faculty, students, and policymakers, we have to all together to collaborate for sustainable social accountable efforts. And we'd like to hear from you, how will you contribute to advancing social accountability in program? Alhamdulillah, now with the collaborative effort of the 4 colleagues in every colleague that we are working together in advancing social accountability, either in the dental program, health science, the pharmacy programs, and so on. And we need more efforts to be done. We need more hands to come together to advance social accountability to serve our community. I always ending most of the presentation with this African proverb: if you want to go fast, go alone. If you want to go far, we need to go together. And yeah, thank you so much.